Welcome to Learn Medical Spanish. Today we'll be going over some phrases you can use to ask about the ear, nose, and throat system. So it's a review of systems for the ENT, or ear, nose, and throat. This is both a podcast and a YouTube video, and it's also similar to some of the content in my CME course. So if you want to check out the CME course, there's a link in the episode description or the video description. As usual, I'll be saying the phrases in English first and then pausing so you can think about the translation and let you repeat it a couple times. So I'm going to pause long enough for you to say it out loud each time that I say it in Spanish. Here's the first phrase. Do you also have or have you had? También tiene o ha tenido. También tiene o ha tenido. So this phrase introduces all of the phrases that follow. So in other words, some of them will be something like, do you currently have something, like también tiene whatever, and others would be something in the past, like también ha tenido, have you had, like a previous diagnosis of something. So that's the distinction there, but you could theoretically use just this phrase and introduce any of the ones that follow, or you could pick just también tiene or también ha tenido. You could use one or the other or just use it together and it would basically make sense. All right, so here are the phrases that follow. Congestion, congestión, congestión, runny nose, le escurre la nariz, le escurre la nariz. So the grammar there isn't perfect if you say that previous sentence. También tiene, le escurre la nariz. So actually that doesn't totally make sense that way, but this is just a really clear way to say runny nose. So you could just use this sentence by itself. Le escurre la nariz. Another way you could kind of say that is just to say, está muy resfriado. And they would probably kind of understand that as like having a lot of congestion or runny nose. Next phrase, nosebleed. Sangrado de la nariz. Sangrado de la nariz. So sangrado means bleeding. So of course you could use that for any body region if there's bleeding from somewhere. Pain or pressure in your face. Dolor o presión en la cara. Dolor o presión en la cara. So naturally, this is kind of referring to like a sinus problem, but I wouldn't say sinusitis because that's technical medical jargon. So we'd use something like pain or pressure in your face just to refer to the symptoms. Next phrase, sore throat. Dolor de garganta. Dolor de garganta. So you could also say dolor en la garganta, and you'll find with many phrases it's possible to use slightly different prepositions and things like that and still get the point across. Throat swelling. Hinchazón en la garganta. Hinchazón en la garganta. Tooth pain. Dolor en los dientes. dolor en los dientes, ear pain. And this should be the internal ear, the functional ear, not the external ear. Dolor en el oído. Dolor en el oído. So just to clarify, oído again is the functional ear that does hearing and balance. And then the external ear that you can see has a different name, and that is oreja, la oreja. Next phrase, decreased hearing or difficulty hearing. Dificultad para oír. Dificultad para oír. And I get that's kind of ironic if you're asking them if you have difficulty hearing, but anyway. All right, next phrase, ear discharge. Flujo del oído. Flujo del oído. And that word flujo, again, is kind of like the word bleeding. The word flujo, which means discharge, you can apply to various body regions. So that's also how you'd say vaginal discharge, for example. Flujo de la vagina would be one way to phrase that. Or flujo vaginal. Next phrase, ear infection. So remember, these are all introduced by do you have or have you had? Like, ha tenido ear infection. Infección del oído. Infección del oído. There's another useful word you could apply to many different body parts. Infección. Throat infection. So here's another rep of that word. Infección de la garganta. Infección de la garganta. And sure, you could also say infección en la garganta. So like an infection of the throat, an infection in the throat. Makes sense either way. Sinusitis. So this is a more technical term, but this is like if they've had it in the past, then maybe they know what it's called, you know. Like, have you had, ha tenido sinusitis? Sinusitis. Sinusitis. So as you probably noticed, this is one of those words that is spelled exactly the same, but you just pronounce it differently by using the correct vowel sounds in Spanish. The consonants are pretty similar, but it's mainly the vowels that change, where you go sinusitis as opposed to sinusitis. That was the last phrase for this short dialogue. If you want to find more similar dialogues, of course, if you're on the podcast, there's a bunch on there, and there will be more soon. And if you're on YouTube, you'll see a link to the playlist with a bunch of other dialogues like this and other similar videos. And then also a video that explains my CME course in more detail. And there are some other resources in the podcast episode description or the video description. Thanks for listening, and I'll see you next time on Learn Medical Spanish.